Hello everyone. Reversal of diabetes is the latest thing in the market. Let's see, is it a reality or is it a hype? What is it? We all know about the natural history of diabetes. We all start with normal glucose values, let's say a fasting of less than 100 and after meal of less than 140 and average of 5.6 and below. But with time, someone who has a risk of diabetes will become pre-diabetic, then progress to diabetes, then get into complications. So this is the natural history of diabetes and we are trying to reverse it or to come back. Instead of going with the tide, we are trying to swim against the tide, and lifestyle disease needs lifestyle solution. So that is the mantra I have it for all my patients, and that is what is important if you look at reversing or in remission. Firstly, please understand, it is not reversal, it is remission. Reversal has become a hotcake to sell and sometimes fool the public also. But remission is the reality. What is the difference? Reversal means you are a diabetic, you do whatever you do, and then you become normal with respect to glucose, normoglycemia, but you never get back diabetes. We honestly don't have evidence for that. Remission means you are a diabetic, you do so and so things. Now your sugars are in the normal range. Average sugar is less than 5.7, called as complete remission if it is for 1 year. Or if it is less than 5.7 for more than 5 years, we call it as a prolonged remission. Not exactly reversal. So please don't get fooled about it. What is the problem is you get into a false reassurance and many times will come back to us with 400, 500 sugars and in acute complications, especially if you don't try to monitor whatever form of therapy you do, friends. You always remember that you need to monitor it. We need to see what's exactly happening. And please remember, what we are talking about reversal remission is only for type 2 diabetes, not for type 1 diabetes. Do you have any examples of remission? Yes, of course. Naturally also we see it. We all know in type 1 diabetes there is something called as honeymoon phase of diabetes, where diabetes goes off, the glucose becomes normal, but only to come back later. But that is an example of remission there. Gestational diabetes, pregnancy diabetes, where we see sugar values going up, sometimes requiring insulin, but post-delivery, it comes back to normalcy. Sometimes stress-induced diabetes, when we become less stressful, or steroid-induced diabetes, for various reasons we may use steroids, and when we stop it, it will come down. And of course nowadays people, when they do bariatric surgeries, definitely we have seen people going into remission. They are off their medications because the diet becomes very imperative there and very important because of the limitations due to the bariatric surgery. They can't eat as well. Then the sugars become normal. Sometimes it bounces back. So be vigilant is what I would like to say. So the key points what everyone should know is please understand that it is remission, not reversal, because you can get into a recurrent state or re-reversal state to back to diabetes. Second important point is it's only for type 2 diabetes. Please don't try this stunt for type 1 diabetics. The key factor here is maintenance of weight loss, and of course, as I said, keep an eye on your blood glucose. And always remember, whatever evidence we have in the world is only for up to 2 years for this remission. What is the key? A very low calorie diet and a very low carbohydrate are the effective strategies. Sometimes the low carbohydrate diet can cause remission without causing significant weight loss. But weight loss is the key. If you can keep it to more than 15 kgs of weight loss, then remission is a possibility. There are many trials like the direct trial, counterbalance trial and counterpoint trial which have looked into this remission of diabetes, and they have achieved in about 46% of the intervention group remission. And this remission was directly proportional to the weight loss. Most importantly, quality of life improved in people who lost weight. So that's a big factor, the feel good factor, isn't it? We all lose weight and we feel good about it. So who is ideal for prescribing this remission? We should try in every patient whom we see. After all, what are we trying to do? Trying to change their diet pattern, isn't it? So why don't we all do it, not only for diabetics or even non-diabetics, obese people, even healthy people need to be on diet and exercise. But ideal people is the people, I call it as ABCDE, the one with A1C of around 7 to 8, the one with body weights who are higher the body weight, hopefully higher you lose it. The C-peptide, which is an indirect measure of insulin reserve, if it is high, we can try for remission in them. Duration of diabetes, if it is less than 6 years, it's better. The longer duration diabetics, even though some trials have shown some data, but the remission rates are much lesser. And most importantly, friends, enthusiasm. If you have higher the enthusiasm, the better it is to work for remissions. So friends, what I always talk about is, after all, diabetes, hypertension, obesity, heart disease are all lifestyle diseases and they need lifestyle solutions. Let's talk about remission and let's work on prevention. Thank you very much.